Be a law that makes it easier for mentally ill men and women to seek treatment, keeping them well, keeping the community safe.
But it has turned out to be more of an embarrassment than an accomplishment. But that could soon be changing. 7 investigator Ross Jones is here now with his latest report. Ross?
Carolyn, Stephen, we have called this series Waiting for Disaster because when it comes to treating the mentally ill in Michigan, real help only comes after a crisis. But today in Lansing, lawmakers took a step towards reversing that by fulfilling a promise made 10 years ago.
Why is it that we have to wait for somebody to commit a violent offense before we get them the help they need?
In Lansing today, Representative Tom Leonard joined the Lieutenant Governor and newly appointed State Court Administrator testifying in support of legislation to strengthen the state's mental health code.
The truth is that families can see the crisis coming weeks before the crisis arrives. We do not wait to act for any other illness. Why do we wait when it's mental illness?
They were here pushing for changes to Kevin's Law. On the books now for 11 years in Michigan, it's supposed to make it easier for men and women to receive outpatient mental health treatment. Yet today, it's barely used in any courtroom. One reason, say experts, is because the law requires a serious incident like an arrest to occur before treatment can be ordered. But under this proposed legislation, a family member could seek mental health services for a loved one before a crisis ever happens.
If any of you have not heard of or heard from Ross Jones, who's an investigative reporter from Detroit.
And our reporting on the failures of the law and the state's mental health system were discussed at today's hearing. Stories about people like Ron Rudy. His family says the mental health system ignored his cries for help to treat his schizophrenia until the day he stabbed his best friend 14 times. And the story of Bill Becker, the first person to seek help under Kevin's Law in St. Clair County. After a months-long spiral where he failed to attend court-ordered treatment, he was found dead.
Something comes out of the blue. It's really hard to have a system to take care of that. But what if it was obvious? And that's what we're talking about here, are the cases when everybody knows.
Callie, Mack, and Leonard testified for nearly 90 minutes today and faced little opposition from House members on the Committee for Health Policy. Afterwards, Callie seemed optimistic that the legislature would take action and finally deliver on the promise of Kevin's Law.
It would be a waste of everybody's time, but more important than that, a travesty to families in crisis if it's another 10 years before we determine whether or not the law is working.
When we started down this journey about a year ago, I was not optimistic, but I am now. I think the opportunity for change is here, and I think actually your reporting helped make this happen.
The committee is expected to vote on the bill next week, and it could go to the full House as soon as next month. Of course, if it does pass, it'll only be a small step towards providing better care. There is much more still to be done. Carolyn.
Wow, good reporting, Ross.
Thank you very much.
Still ahead on Action News.